I'm James Beckwith, President and CEO of Five Star Bank. As a community bank, we believe that open dialogue about the issues affecting our region is vitally important. From the economy to the environment to social issues, we look forward to the conversations and hope you'll join in.
Welcome to Studio Sacramento. How many times have you been talking to someone about a health issue and someone says, well, I was watching Dr. Oz and he said, since its launch in 2009, Dr. Mehmet Oz has gone from an occasional guest on Oprah to the Johnny Appleseed for a thinner, healthier, and longer living America. Dr. Oz is in Sacramento to plant his latest initiative, Health Corps, for promoting health literacy and healthier lifestyles for our children in 3 local high schools. Welcome, Dr. Oz.
Thank you very much.
Well, Dr. Oz, I want to just show you a couple things. You know, I watch your show, and we have the ultimate raspberry ketones right here. We have white bean extract. And I'm told now that the latest holy grail in weight management is green coffee bean extract. Which our director was looking furiously for on the internet, and it's almost like a futures market where it is that the price goes up the minute it comes on your show. Where do you find all this stuff?
Well, I am blessed with a wonderful team. Almost 200 people work on the show, and we tape it in New York City at 30 Rockefeller Center. But culturally, a lot of this concept of just focusing on the service to your audience came from working with Oprah. I probably did 80 shows with her, as you mentioned at the outset, and I learned a lot about how we think about health very differently. So when we look at different ideas and products, remember, I don't sell any products. We don't allow you to buy any products off the show, on our websites, and I personally never endorse a product. We try to find out where the science lies. We'll trust experts if they're ones who have had personal experience with it. I just want to emphasize something. I never want anyone to walk away from the show thinking, you know what, if I just take that pill, I'm going to lose a ton of weight. You are kind enough to share your personal stories, and I know you've lost some weight, which I attribute more to your ability to figure out how to make life easier when it comes to weight loss than any supplements you ever took. But some of these supplements are quite effective. The white bean extract is a good example. It was brought to my attention by another physician. Our medical unit, it's the nuclear reactor of the show. It's made up of medical students and health producers who just focus on the science behind these ideas. You know, it seems to change the way you metabolize carbohydrates. So it made sense. It's been looked at in a variety of different models, and we thought this is something that's worth sharing with America. And what we try to serve as is the repository for information that you ought to know if we just had the ability to get it out to you. My litmus test for telling you about it is what I tell my family, the same thing.
Good to know, good to know. Well, part of what you're doing, though, in a way, is are you mainstreaming complementary medicine and the thought that vitamin therapy and how we view food as almost a nutritional supplement in itself, you're bringing that into kind of mainstream America?
We have, as a species, always felt food was sacred. Think about it. When you eat a leafy green vegetable, you're taking nutrients from the sun and from the soil, merging them into this wonderful product that happens to be naturally made. And because it's whole food, it's food that comes out of the ground looking the way it looks when you eat it, it generally allows your body to metabolize it the way it's supposed to be metabolized. When we move away from that paradigm, that model, and more towards packaged foods, processed foods, fast foods, it's an away game for your body. Your liver, which is the main detoxifying organ of the body, has trouble keeping up. You're predisposing yourselves to perverting the delicate metabolism that governs your weight. There's a dozen redundant systems they drive you to eat. We're supposed to always eat. Our species never had a desire to lose weight until the modern era. So all of these are reasons why we trip up and start gaining weight at a ponderously heavy level. So I think there are opportunities for us to just change the way we think about the power of food in our lives, the power of nutrients.
Well, interesting you raise that. A couple of months ago, we had a woman on who started a farmers market movement up here in this part of California. And she said on the show, along with her guest who had written a cookbook, that in fact, that eating naturally and healthy may be more expensive when you purchase it, but you consume less because your body knows that it's getting the nutrition it needs instead of starving after you eat something that's processed or plastic, you might say.
It's a very wise insight, and a clever thing that a lot of folks will do is they'll buy at a farmer's market or they'll buy in bulk with other families in the community, or they'll buy frozen foods, which are a very smart way for many parts of the country to get their produce. Now, here in the Sacramento area, it's very different. You have access to some of the most unparalleled sources of healthy food.
Breadbasket of the world.
It really is, and take advantage of that. If you're blessed to be able to live in this area, you can usually afford to buy the foods more than anybody else can. But if I can go back to this issue of complementary medicine. For me, integrative complementary medicine, alternative medicine, is a globalization of medicine. It's
Really?
taking ideas that have already been used in other parts of the world and allowing us in this country to now begin to use them as well. Listen, this show we're making right now can
Give
be
us an
seen.
example.
Tai Chi, acupuncture, yoga. Many of these ancient practices have been used for millennia in other parts of the world. Many traditional Chinese therapies have been vetted out in their journals and in their practice for many centuries. So, it's pretty much weathered the time well in order to still exist today. So when we bring these concepts to America and someone says, well, I tried acupuncture for my addiction to cigarettes and it worked, we shouldn't be shocked. It's not that it's going to work for everybody. But in the West, we've never thought of those therapies as contributing to us. Yet in China, they have Western medicine doctors, right?
Now, a lot of that thought influences your own life because you're a practitioner of yoga, correct? And you do that in the mornings.
I do yoga this morning. I did as well every single morning. I don't do a 45-minute intense, yoga workout. I do about 7 minutes stretch with some calisthenics. I wish I had been doing it earlier in my life. But the reason I love that is, A, it reinforces that I control my destiny. Listen, if you can't carve out 7 minutes for yourself in the morning, then you have to admit to yourself that you're not in control of what's going on in your life. But it also stretches me. And as a surgeon, and I still operate on Thursdays, when you're hunched over the table and operating all day long, it causes lots of orthopedic issues. It allowed me to do my job better, that I could do that stretching in the morning.
Well, one of the interesting things about your yoga and the stretching that you're talking about in terms of keeping yourself limber in shape is you're the CEO of a lot of different enterprises. And there was a quote of yours that talked about how you think less about time management than you do energy management. Can you speak to that a little bit?
One of the most common realities we all face is there's just a limited amount of time to do things you want to do in life. But what you really will find over, I feel, your life, that it's really about the chi you bring to what you're doing, the energy you bring to what you're doing. So if you're in a creative space, then you're working smart, not just working hard. And I find that oftentimes, I fall prey to this as well as I'm sure many of the viewers, you're working so fast, you're not working smart anymore, just working hard, and then you run out of time. But if the things you're doing are giving you energy, then you'll actually have more of that energy to pass out in the projects you're working on. And that's that creative force that I find so valuable. I'll share a little secret with you. Everyone on my team is offered Transcendental Meditation. Now, we have, it's an intense work environment. We are in 30 Rockefeller Center, which is arguably the media capital of the world. Lots of stuff happening, lots of pressure to make the best show possible. And yet, I want them not to be so destabilized by all those pressures that they can't connect those disparate dots on the horizon, which is what creativity means, right? Creativity is putting together concepts that were obviously out there, but no one else put them together before you. So Transcendental Meditation has changed the lives of many of these dear people who work on the show because it's allowed them to be more creative. So instead of trying 5 things and figuring out which one works, they can vision that 1 or 2 will be the best ones and sort of go in that direction first.
Wow. Well, I've been doing that since I was 8 years old.
You have?
Yeah. So, yeah.
Who taught it to you? That's just a crazy exposure to have at a young age. It's great.
Well, it was one of the original acolytes of the Maharishi, but that's another story.
I love that.
For a different
It's
interview.
fantastic. This is great.
Anyway, I wanted to ask you, in the 3 years since the show started, what have you learned about the power of the medium and just about all of the people that have touched your show?
The medium is a much more sophisticated place than I ever envisioned. There are a lot of subtleties to making programming that works. The most important tip of all, it's a tip that Oprah shared with me early in my career, is to be 100% focused on what the audience needs, not what you think that they want or your desire to talk about something. So people often ask me if I want to talk about a topic that is interesting to me personally, personalized medicine. But if you're sitting at home in Iowa and you're making $35,000 a year, and you're struggling just to make ends meet financially, you don't have the time to do what you want to do in life, you don't think people are listening to you anymore, in fact, you think your best years are behind you, you're not interested in some esoteric conversation with scientists. You want to know if I'm there for you. And iconically, I always think about our viewers as 500 years ago living in a small village and always having a healer near them. What would the healer say? Healer wouldn't just give you advice, they'd hear you first, they'd validate you, they'd witness you, and then they'd allow that conversation in its own right healing to then move into a place where maybe I can give you some advice. So I spend a lot of time learning how to talk to people better. You know, I've got two strikes against me on that regard. I'm a doctor, I'm a male. Right, we share the latter, in particular, and I find that, you know, a lot of times I don't listen as well as I should, and that experience of understanding what the real question is, what's the real pain point that's prompting you to pay attention to the show. If I can focus in on that, the experience is a much more fulfilling one for you. Because remember, although I host a show, I'm really a guest in your home. Right? I'm going to spend time with you where you live. You're inviting me into that house at, you know, at a critical time in your life when you don't have a lot of time. I've got to make that experience worthwhile for you.
Well, let's talk about personalized medicine, since it's an interest of yours. There are a couple of interesting things going on trend-wise that I'd like you to respond to. There is more of a move toward personalized medicine. Recently, Mark Andreessen, who started Netscape and invented the World Wide Web browser, has been investing in healthcare technology. And he told a story at a conference where he said that he went into his doctor's office and the doctor said, okay, well, what are your symptoms? And Andreessen said, well, I'm not sick, but what I have is data. And he dropped a couple-inch stack of healthcare data related to his own life on the physician because he was looking for a diagnostic. He was interested in wellness, in extending life and living a healthier lifestyle. And there still seems to be the practice of where it is that medicine and healthcare is focused on curing what ails you, not extending and expanding what's healthy about you. Where there is, though, a growing interest on the part of people to get that sort of data. Where do you think this is leading our healthcare system?
Well, there's a natural challenge when you give someone advice that you think may help them theoretically in the future versus really helping them today. And that's the dilemma always when physicians are seeing patients in their offices, one I experience every week. You'd hate to do prophylactic heart surgery, right? It's a big deal to take a bandsaw through someone's chest. Giving someone a medication likewise can have complications. So we try to be slow in those movements. However, giving people lifestyle advice is relatively easy to do. With many upsides besides the fact that you'll live longer. It's because you'll live better today as well. And I think most of America is living at about 25 percentile of where we ought to be. We have a lot of opportunity to grow, so we enjoy today's life better, which, by the way, is the main focus I make on the show all the time. I want you to live longer, but I want it to be the side benefit of living better today. So personalized medicine is so important to me because if you have a headache and I give you a medication, let's just say I give you aspirin, right? Aspirin's a pretty ubiquitous product. We've all taken it in our lives. Yet we know that probably a quarter of the time it really doesn't work the same in you as it does in everybody else. So now I've given you a pill that's such a commonly used tool, but I know that 1 out of 4 times is not the right thing for you. So the ability for me to predict which will work for you best and avoid the trial and error, which is what modern medicine usually does. By the way, this is true for chemotherapy, it's true for heart medications, it's true for blood thinners, almost every major depression drugs, every major category. The major pharmaceutical companies know that at least 1 in 10, often 1 in 5 people aren't going to respond like everybody else responds. If I could just tweak that a little bit and stop missing the target on 20% of the population, it'll enhance the quality of life for all of us. Even more importantly, the way foods affect us are varied. Let's talk about weight loss. Since congratulations, you've lost a bunch, and that's wonderful. It turns out that your genes will predict what kind of diet will help you lose weight the best.
Okay, and I'm glad you went there because cynics would say that personalized medicine holds out false hopes that you can outrun your genetics.
Well, 70% of how long you live and how well you age is your lifestyle.
It's not genetics.
No, it's 1/3 genetics. And your genes are important if you're 10 years old because obviously most of your lifestyle or your morbidities, your complications of health are related to genes. But by the time you're age 50, 2/3 of your quality of life will be driven by the lifestyle that you've adopted, not by the genes you have. People often say, well, my father died of a stroke. I have a high risk for a stroke. Why? So first of all, did he smoke? And was he hypertensive? Because if those are two realities existed, that doesn't mean your genes are bad. It means you don't have genes that protect you against cigarette smoking or protect you against obesity or hypertension or whatever it may be. So your genes will color your ability to be resilient against certain weaknesses, but that's the power of personalized medicine. If I know, for example, that if I cut out carbohydrates from my diet, I'll really lose weight versus, for example, cutting out saturated fats, then I can go ahead and enjoy some of the other meals a little bit more because I know my ancestral genetic makeup allows me to avoid complications if I just cut out the carbohydrates. Then I know that, you know, I have a predisposition to hypertension, but I don't have to worry about prostate cancer.
Right, but putting the patient sort of in the driver's seat, you know, there are things like, there are these mobile heart scan type programs where you go and get your heart scanned and that sort of thing. You know, is that too much data for the layperson? Can we really be that well informed where it is that we can drive those types of healthcare decisions?
I think the value, and I should be clear, getting scans of your heart, which is of value sometimes, is not the same thing as personalized medicine. Okay. For me, personalized medicine is predicting how your lifestyle and how medications you may receive, procedures you may undergo, will be treated by your body versus someone else's body. Getting a scan of the heart has a value because I might say, okay, you know what? I don't know if your high cholesterol numbers ought to be treated. So let's look to see if you actually have plaque in your body. If you have a plaque in your body, we should treat your high cholesterol. If you don't have plaque in your body, maybe I shouldn't treat that problem because we don't really understand all the nuances of how cholesterol affects your health. So I will usually use testing tools like scans of your heart only if you have another risk factor. There are many people wandering around who are on medications who probably should not be on medications. If we just looked inside of you and saw you weren't going to have a complication from whatever you're trying to prevent, we could avoid the complications of taking the medication.
Let's go back to the 10-year-old. You're in town to talk about Health Corps, all right? Tell us about that initiative and where it came from.
Health Corps is dear to my heart. About 10 years ago, I was part of a Health and Human Services panel looking at how to avoid childhood obesity. And this is a room in Washington full of the heads of all the major pediatric associations. There were many groups represented that really had insights on what caused childhood obesity. We walked away from this meeting with no game plan.
No game plan?
No game plan. And the reason for that is even the most obvious recommendation. So, you know, TV watching. Kids who watch more TV gain more weight. Get rid of TVs, right? Makes sense. How do you do that? Kids who are generally in that category are often living in inner city areas where it's dangerous to be outside, or the parents are overwhelmed and need something to babysit the child. TV represents that. For some of these kids, the best English they're going to hear is television. So it's not as easy as just telling mom to send the kids outside to play. It's maybe more dangerous than sitting inside.
That's interesting. I've never heard that before.
So I'm just giving that as one example, but every single of these 17 points that I heard that day were rebutted. So I went back home, and you know, fate has a way of working. I was asked to consult on a young 25-year-old Latino woman who was overweight, and she had been most of her life, and she needed coronary bypass surgery. So I did her bypass. 25, think about this. Think about the cost to our economy if we're doing heart surgery on 25-year-olds for acquired illnesses like heart disease. So I do the surgery, she does great. I'm giving myself a rotator cuff injury, patting myself on the back as I walk into her room the next day. And she, of course, is over the moon because she survived the operation. Everything looks great. Her husband's there. He's, as she is, portly, overweight, obese. 2 little cute kids. They're also overweight. And they're all sitting in there, and she's bought, she's with them. And to celebrate the fact she's doing well, Dad had picked up a bunch of hamburgers, some big extra large size soda pop, and some French fries. And I thought, I failed these people. Because although I did her heart surgery, which is what she was asking me to do, what I really needed to do was to get her to understand how she controlled her destiny. So we started a program called Health Corps, which is part of the reason that I love coming and visiting Sacramento, which I do frequently, because it's based here in Sacramento, which I do think is the prototypical city for America right now. Sacramento has figured out a lot of things about health and is going to lead the way for the rest of the nation to follow. Health Corps goes into schools and takes college graduates, just like the Peace Corps would.
Or it sounds like a Teach for America for Health.
It's similar for Teach for America. In fact, we work with them. But I think the best metaphor is the Peace Corps, because you took those college grads, you put them through a summer program, you teach them about how to teach, and you teach them about health. And then instead of putting them in other countries to create irrigation systems, you put them in high schools around this country. And you let those kids work there for a year or two. And these college grads are like big brothers, big sisters, mentors for the high schoolers. And we see that a lot of the conversation happens outside the classroom. The last question is about how do I lose weight, get rid of my acne, I'm not performing well in school. And the big message is, for me, because we touch about 35,000, 40,000 lives a year now through Health Corps, these kids want to learn about their bodies, they're curious, and there's a fascination about the sacredness of the body, the temple of your soul that goes along with this. They earnestly are. They never appreciated or were aware of how foods would influence their performance in life and in school. They didn't appreciate physical activity and the role that it plays in getting you ready for life. But the most important takeaway, of all. The reason that I'm so in love with HealthCore is that if you as a child, and it's a serpentine path in life, I mean, it's hard to see the light at the end of the tunnel, if you can begin to realize you can control your body, then you'll all of a sudden have the epiphany that you can control the world outside your body. Really? And that's the big transition. And you see the glimmer in their eyes when they light up and they realize, my goodness, I can do this. If I show up in my own life, I'll change the world around me. I'll change the future because I'll control it. And when kids get that message, and when they have that mentoring, they begin to go out and instead of becoming a weak link, the Achilles heel of our society because they're overweight and they're going to cost us a lot of money and they're not going to perform, instead they become the leaders of society. That's why for me, HealthCore is an activist organization. I want these kids going off. Many of them will go into the health fields. They'll come out of communities, many of them underserved, where people don't usually go into nursing or doctoring or physician's assistants, whatever it might be, social work. And they'll be able to change their communities because they're all engaged. That's why we work so closely with the California Endowment, many civic organizations, Kevin Johnson here.
You just got a big grant from Blue Cross Anthem, right?
Blue Cross Anthem, wonderful partners for us. Robert Wood Johnson. I mean, we've really been able to get on the radar screen of a lot of very prominent groups who realize that they need boots on the ground. We all have high interest in changing the issue of obesity in America, especially childhood obesity, because the kids are our future. You know, why would you mortgage your future with the bad health of your children? That stated, we need people in our schools to lead this movement, and that's what HealthCore tries to do.
Well, what's the data? You've had some results since you started in, I think it was Washington Heights or
Washington Heights in northern, which is where Henry Kissinger went to school, by the way. You know, it's a wonderful school that fell on bad times and was taken over by a group, and it changed. So we launched a school, and by the way, my hospital, New York Presbyterian Columbia University, is right next to the high school. So I could just go from the OR to the school and come back. So we started there, but we have done double-blind randomized trials, which is, as you know, difficult to do. In this setting, and we have demonstrated that kids will change their behaviors towards food. For example, they'll voluntarily drink less soft drinks, especially the girls. And we're looking at other metrics of how these kids benefit and what do they actually weigh when they go through these programs. And you know what? We're looking at truancy rates. If kids feel pride in who they are, do they show up for school more? Do they weather the storm of adversity, which we all learn to do in our lives, and learn it at an earlier age?
Have you seen any impact on their parents once these children become health literate, so to speak, in terms of them influencing behavior upstream?
I'll see you know, I tell my own kids this because I've learned it, I've seen it from them as well. When these wonderful high schoolers learn about, for example, how to read a food label, they'll go into their refrigerator at home and they'll say, Mom, there's high fructose corn syrup in this jam that you bought. Did you know that? So think about this. Your parents, and you know, they're going to get a hard time from the kids anyway, right? You might also make it a valuable thing to give your parents a hard time about. So again, kids love the fact that they can nudge their parents a little bit, give them a hard time. And again, they become activists in their community.
Wow, that's pretty amazing. Now, another initiative of yours is called Transformation Nation. Tell us a little bit about that.
Transformation Nation came up of an idea we had last spring, which was that if people want to feel like $1 million, if they want to look like $1 million, well, maybe we should give them $1 million for doing it. So we launched a nationwide campaign. We had modest goals. We thought we'd sign up a few 100,000 people to engage in this 7-step program to better life. It's a free program. It's on droz.com, by the way. Folks are welcome to use it. We signed up 1.25 million people. They competed all year long. The finalists lost 25 pounds on average. Many of them lost more than 100 pounds. And we have narrowed it down to just a few people who represent what transformative health feels like. I'm not just interested in who lost the most weight. I want to know who truly transformed themselves and represents what the country did for itself. Who's sleeping better? Who's dealing with their anxieties more effectively? Who's connecting with their doctor more insightfully? Who's been able to create a community around wellness so now everyone feels that they can actually own a piece of the rock? And we've got 10 finalists that all America is voting on. It's like American Idol, but around health. These are fascinating stories about people who are doing it for the right reason. People who are trying to lose weight because they know that by doing that they can save other lives, including their own.
Do you have one compelling one that you can share with us, which kind of is an example?
There's one absolutely fascinating story that I was reading through. I got all the summaries of a man who needs his loved one to get a kidney because their kidney has failed. And he wants to donate the kidney, but he was too heavy. He wasn't healthy enough to donate the kidney. So he has transformed his health so that he'll be able to give the gift of life to another. And that's just the tip of the iceberg. These stories, every single one of them, they put goosebumps on you when you read them.
So in our closing moments, Dr. Oz, this work, your journey has been an amazing one. From both your background, you come from a family of immigrants, your journey in the medical profession, then on to television, and then all these other lives that you're touching. How would you like to be remembered when you look back on all of this? Or would somebody else does after an extremely, extremely long and well-lived life?
I would love if people would say he brought a little light to life. And when I say light, I speak of the fact that obviously on television the medium has light in it, but it's also fun. It's joyful and celebratory. That's why I don't want the show to be sour and dour. My experience with you, all these you books that we write, they're always pointing at you because it's about you, and it's written in a jovial way with fun pictures, because I want it to be enlightening as well as fun. But I do think by bringing light to your life, I have to bring insight to your life as well. And if I can share some insights, enlighten you, and enlighten your load, then we'll have achieved our goal.
That's wonderful. Incidentally, I guess that we should close out by saying that the bookend of this is that your wife, Lisa, actually wrote the complement to that, which is called Us.
Yes.
Talking about the importance of relationships.
Well, I always joke with her. Again, just to be clear with everybody, my wife is absolutely the brains of the family.
Well said.
And if I could give you one little tip my father-in-law shared with me the week I got married, he said, when it comes to my daughter, give it on the small things, so when big things come up, you'll know what it feels like.
I like that. And with that, Dr. Oz, welcome to Sacramento. Hope to see you again soon, and thank you very much.
I really enjoy this. Thank you.
Well, that's our show. Thanks to Dr. Oz, and thank you for watching. For Studio Sacramento, I'm Scott Syfax. See you next time right here on KVIE.
I'm James Beckwith, President and CEO of Five Star Bank. As a community bank, we believe that open dialogue about the issues affecting our region is vitally important. From the economy to the environment to social issues, we look forward to the conversations and hope you'll join in.